Thank you for subscribing to this channel. This is a reading part C practice video.
Option A is correct according to the paragraph. Dr. Mike Kramer, the representative of the Royal College of Surgeons, regards the smoking status of the patient as a significant factor when treating a smoker. He mentions that the risks of procedure versus the benefits is affected by the smoking status of the patient, and complications associated with smoking are so significant he will delay an operation for the removal of a lung cancer so a patient can stop smoking for a minimum of 4 weeks before an operation. Therefore, the length of time a patient has refrained from smoking is crucial in deciding the benefits of a patient's outcome. Option B is incorrect because it does not address the specific factor mentioned in the paragraph. Although providing an unbiased assessment of each individual is important, it is not the focus of the paragraph or the question asked. Option C is incorrect because it is specifically mentioned in the paragraph that Dr. Mike Kramer's judgment is not based on moral or ethical considerations. Therefore, considering the ethical implications of each case is not relevant to his decision-making process. Option D is incorrect because the patient's attitude towards smoking cessation is not mentioned in the paragraph as a significant factor in treating a smoker.
Let's look at the next question.
Option C is correct according to the paragraph. Reverend Norman Ford suggests that smokers who refuse to quit before surgery should pay the additional expense if wound infections occur, which would incentivize them to change their behavior. He says, if they give up smoking, they should be treated the same as non-smokers. If they don't give up smoking, they should pay the difference, and that the pocket is a great motivator if they've got it. Therefore, making a smoker pay incentivizes change. Option A is incorrect because Reverend Norman Ford suggests that smokers should pay for the additional expenses incurred due to their smoking, not their entire operation. Option B is incorrect because although Reverend Norman Ford does mention the limited health dollar, he does not suggest that more public funding is needed to help smokers quit. Option D is incorrect because Reverend Norman Ford suggests that smokers who refuse to quit before surgery should be held accountable for the additional costs incurred due to their smoking.
Let's look at the next question.
Option C is correct according to the paragraph. The phrase, "Why should non-smokers fork out for smokers?" indicates that Reverend Norman Ford believes that the public should not bear the cost of smokers' health care. He suggests that smokers who refuse to quit before surgery should pay the additional expense if wound infections occur, and their ability to pay should be means tested. Therefore, he advocates for making smokers pay for the additional costs incurred due to their smoking. Option A is incorrect because it is not addressed in the paragraph. Option B is incorrect because the paragraph does not make any comparison between smokers and non-smokers regarding complications. Option D is incorrect because the paragraph does not make any comparison between smokers and non-smokers regarding public funding burden. In the final paragraph, the writer argues that treating smokers differently could in turn lead to poor decisions concerning other patients. The writer suggests that denying surgery to smokers could lead to a slippery slope where surgeons would choose to operate only on low-risk patients, which could lead to discrimination against other patients. Therefore, option B is the correct answer. Option A is incorrect as the paragraph does not suggest that treating smokers differently is fair because other patients haven't made such poor lifestyle choices. Option C is also incorrect as the paragraph does not mention that treating smokers differently may cause such patients to avoid having health checks. Option D is not supported by the paragraph as the writer only uses diabetes as an example to argue against denying surgery to smokers and does not suggest that it may lead to discrimination against patients with diabetes.